Respected judges, distinguished audience, esteemed competitors, this is a longitudinal study that we are presenting. We all know the L.V. Prasad Eye Institute Vision Pyramid. The Alma-Ata Declaration in 1978 had emphasized primary health, but it took few years for this to come in eye care. But even though literally hundreds of vision centers have been established in the past 20 years, there is hardly any proper data which shows what difference it has made. So we wanted to examine the eyes and vision of an entire population, a community in a slum in Pune, to set up a vision center in that area and to re-examine that community after 4 years to see the impact of our intervention. We used the Operation Eyesight Universal's technical advice, and 4 trained community health workers did a screening of each and every individual. Those individuals who had vision less than 618, they were referred to the vision center, which was within 2 kilometers of their residence. At the vision center, an optometrist performed a comprehensive eye examination. Those who did not improve to 612 were examined by an ophthalmologist, who also assigned a cause of visual impairment and blindness. But if these individuals did not come to the vision center, then the optometrist went to their homes and using a handheld slit lamp, autorefractometer, tonometer, did the entire examination in the homes. If they felt that an ophthalmologist needed to see them, the ophthalmologist, she also went to the people's homes so that each and every individual was examined properly. And the 4 community health workers, the social worker, one of the optometrists, and ophthalmologist were all ladies. These are the age and genders of the 2 cohorts, and we had 44,535 individuals, of whom 43,708 could be examined after 4 years. Some had died, some had moved, a few refused examination, and very few were lost to follow-up. And if you will see the OPD, the number of cataract surgeries, the spectacles prescribed, and the spectacle dispensed, there is a female preponderance. Almost 60% of it is uptake by women. If we look at the vision that has been examined, you can see that the prevalence of blindness has reduced in the better eye, as has the visual impairment. But here, women have almost 1.5 times the prevalence of blindness as compared to men. And it's not just the better eye, it's the worse eye, because we have to treat all eyes. Even in worse eye, the shift is even bigger. And if you look at the causes of blindness, cataract, glaucoma, and corneal causes are there on the top. Diabetic retinopathy is not that much. And even after 4 years, cataract is still a significant cause of blindness. I'll come to this later. Same for visual impairment. So what was the impact? We definitely reduced the prevalence of blindness. But even after that, women still continued to have a higher prevalence at both the points, even though the gender gap was narrowed after 4 years. On an average, the population had become older by 4 years, but the prevalence of blindness had reduced. We attribute both these phenomena, greater number of people available for repeat eye examination and more women seeking eye care, to the house-to-house screening and the vision center predominantly served by female staff in the community. So the strength is, of course, more women accessed. They got comprehensive, reliable service. The service paid for by itself. The initial outlay was from our private paying patients. It's done by a single small clinic. We gave person-based individualized care with health education and promotion. But then it's costly in terms of human resource. And of course, we did not measure inter-observer variation of the CHWs. And if you look at all the studies that have been done earlier, all of them are based on stratified random sampling. This is a study in which we have examined the entire population, the entire universe, and we have come to the result. And of course, it is a tribute to us Indian ophthalmology that if we had 1.34% as the prevalence of blindness in 71, even in a slum in Pune, which is a relatively better off, it is today just 0.21%. That's less than the WHO's goal for 2020. And of course, this primary center is linked to a secondary and tertiary center, and it has to be linked back also because for low vision rehabilitation, again, we have to go back to the community. We all know vision is needed for economic independence, social interaction, for enjoying life, because finally, healthy eyes lead to happier life. And this is what we all try from our side. But then access is just not important. A lot of our findings were with the Andhra Pradesh IDC's 3 studies, but we know even in urban slums or poor, the priority to healthcare is less. And traditionally, we had 4 barriers for cataract surgery: lack of awareness, bad service, cost, distance. But here we have a center, we have gone to each home, they know they have a cataract. We gave earlier subsidized, later even free cataract surgery, good surgery with clinical audit, so cost is not a this. Distance, it is within 2 kilometers of their home. In spite of that, 4 years later, still cataract is a significant cause of blindness. So when we say we want to make this completely avoidable blindness free, well, there are more barriers to it, perhaps social or psychological barriers, which we have to think of. And of course, even the gender disparity we have to think of. So I would like to acknowledge all the people who helped us with this, and thank you for giving me this opportunity.
Yeah, any of the judges like to make a comment?
Yeah. Congratulations, like your approach to reach the last man in the last mile is wonderful. But I just want to know what additional measures you have taken in order to overcome the barriers. You have mentioned good numbers of barriers. So what are the additional steps you have taken, especially for the females, to overcome the barriers?
Ma'am, one is, I mean, even we were surprised. This is just 3 kilometers away from BJ Medical College or Sassoon General Hospital, which is Pune's, one of 130-year-old medical college. In that 45,000, we found 800 cataracts. And we did the study first year, and for the cataracts, anyone whose vision was less than 6/18, they were followed up every 6 months to see if, so we can't do this in 6 minutes. So we have another study which shows that how the barrier is the first time they go, then the second time they go, the third time they go. But even after 4 to 6 visits, even after 4 years, there are still people who are blind with cataract, even though we say, okay, we will do free surgery for you. But they are still not willing to take it up.
Thank you, sir. So one more thing, you have mentioned that cataract surgery is one of the way of mitigating the barrier. So what about spectacle dispensing amongst these females?
Ma'am, that was the biggest thing. If you look at the data, almost 58% of the specs prescribed are for women. That's girls, and this we have the adult and the children breakup also. And almost 57% of them purchased are also by females. And so if you look at the barriers and the causes of blindness, refractive error is not a cause of blindness because we have been able to address that. Even cataract has reduced, but it has not been eliminated. Even the refractive errors, it's still there, but it's very less.
Thank you.
Thank you, Parikshit. Just one look into your study, which is sort of taking care of one particular community for a long term. And I think that will be the way ahead. If every ophthalmologist takes, one particular area, then that will, as you said, that will not require that RAB survey. Then we'll have a complete this thing. One thing I'd like to know in that community, what was the education level, because that will translate into the what you are trying to say.
So we do not have the Kupuswamy scale. We have it only for the cataract. But it is a lower middle income group. There are some communities which are like very, very poor, but they would be about, say, 4,000 or 5,000 in that 45,000.
Because education and the economy both goes together in terms of eliminating blindness in our country. Thank you, Parikshit.
Thank you, sir.
Just one comment. Really great work. I think 4 year having only 20%, nearly 20% dropout, I think, was about 10,000 didn't come.
No, sir. Only 3,000 didn't come. No, it's not that they didn't come. We had to go to their home. So the question of them coming was not there.
I was just looking at these people who were on dropout, whether they had undergone any procedure in the first visit, because they didn't come in the last 4 years.
So there were only 181 which are lost to follow-up. 222 have died. Only 28 have refused a repeat examination. So,
great.
Thank you, sir.